Hi folks, Dr. Ed Beyer here. Today I'm going to be talking about female hormone imbalances and how traditional medicine, most females when they have these symptoms of hormone imbalances, they go to their OBGYN and really the first thing they do, and I'm telling you, I've been in practice 30 years, pretty much the only thing they do is they're going to put the patient on some sort of birth control pill or patch or injection to try to temper the symptoms of female hormone imbalances. And they almost make it sound like the pill or whatever hormone contraception you're taking is benign and there's no problems to it. I'm here to tell you that the science says differently. And it's very upsetting to me as one who practices functional medicine to see so many females coming into my clinic over the 30 years I've been in practice and see the devastating effects that birth control does on a female body when there is such a better alternative. Now, we all know the symptoms of female hormone imbalances: weight gain, fatigue. Those are the two top symptoms that I get in my 30 years of practice. But these have large effects on the nervous system too, on the brain. So we see depression, anxiety, brain fog, mood swings. Migraine headaches are a very common symptom we see due to hormone imbalances. Weak hair or hair loss or getting hair where you don't want it. Fatigue, poor sleep, night sweats, poor skin, nails, acne. We see that in polycystic ovarian syndrome. We also see endometriosis. This is where not we, but a female has uterine lining in areas where it doesn't belong, and that that ectopically placed endometrium will respond inappropriately to these imbalances. A lot of females who don't have female hormone imbalances have endometriosis but never feel it. Bloating, cramping, so digestive symptoms, breast pain, low libido, irregular cycles, and infertility. And so right away, this female is going to go to their OBGYN thinking that they're going to get solutions to these problems when really all that they give them is synthetic hormones, like the pill, patch, injections, or implants. Now, listen, I understand that females have a choice on determining what type of contraception that they want to use, but it's one thing to use birth control pills for contraception. It's another thing to be using it to regulate your hormones, okay? I understand there's a choice with contraception. In my opinion, there's better choices. But if you're using it to regulate your hormones, there's so many other things you can do. I go over in my long video on female hormone imbalances. And the reason why I'm making this video is to make people aware, females aware, of the negative effects of birth control, synthetic hormones on their bodies. So, how synthetic contraceptions work: they raise estrogen levels to a not safe level, and it's not natural. So they raise estrogen throughout the cycle. A female cycle, in the beginning of the cycle, estrogen is high, trying to develop the follicle in preparation for implantation, okay? In preparation for conception and implantation for pregnancy. And then estrogen should drop after ovulation, and then progesterone takes over. So there's an ebb and flow with estrogen and progesterone. What happens when a female takes synthetic contraception is estrogen levels are raised throughout the cycle, and it kind of tricks the brain into thinking that the female is pregnant, all right? And that does get rid of a lot of the symptoms of female hormone imbalances, but my point is, at what cost? And that's what I'm going to reveal to you in the rest of this video. So they keep estrogens at higher levels, and there is no ovulation. I will tell you now, a female is meant to ovulate. It regulates a bunch of other systems in the body. A female ovulates not just solely to get pregnant, but it is the process of ovulation and the resultant increase in progesterone that controls 150 other biochemical reactions in the female body. When you go on synthetic birth control, you do not ovulate, and those 150 biochemical processes don't work as efficiently as they should. Now, these females that I'm going to discuss right now should never take estrogen. They should never want to raise their estrogen levels like we see when someone goes on the pill. Now, the way estrogen gets eliminated from the body is through the liver by way of an enzyme called CYP1B1. You don't have to remember that, okay? This enzyme converts estrogen into a very carcinogenic form of estrogen called 4-hydroxyestrogen. So the first step of estrogen elimination in the liver is actually converting it into a carcinogenic state. Now, many females have a genetic mutation on the gene that makes this enzyme. And so this process of converting estrogen into 4-hydroxyestrogen, which is carcinogenic, is accelerated. And then so they make extra amounts of the 4-hydroxyestrogen. So this female who has this mutation, which many females do, we test them for this, are producing way too much 4-hydroxyestrogen, which is carcinogenic. Now, the 4-hydroxyestrogen then gets converted into a non-carcinogenic estrogen in the liver by way of another enzyme called COMT, C-O-M-T. Many females have a genetic mutation where they're not making that enzyme, and so they're not converting the carcinogenic form of estrogen into the non-carcinogenic form. These are the females that get breast cancer, uterine cancer, estrogen receptor positive type cancers, and all of the side effects of high estrogen, which is what the pill or synthetic contraceptions do. So when we have our females come to us with hormone imbalances, we test for this and we make sure we rule this out. And many of them have this, so they have a hard time getting rid of the carcinogenic form of estrogen. I hope that made sense. So the FDA has declared that raised estrogen levels in the female body due to synthetic hormones may cause increased risk of breast cancer. I'm going to show you a study in a little bit. It definitely increases the risk of blood clotting, heart attack, and stroke, headaches, migraines, gallbladder, liver problems, including benign tumors, increased blood pressure, weight gain, mood changes, depression, anxiety, nausea, cramping, irregular bleeding or spotting, and breast tenderness. These are the things that the OBGYN does not tell you when they so readily write the prescription for synthetic hormones. And a lot of people out there are unaware. Now, synthetic hormone contraceptions contain the same sort of synthetic hormones that a lot of menopausal females have been known to take over the years. And many doctors say that these synthetic hormones are benign, they don't cause any problems, but again, the science tells us differently, okay? It's upsetting. So let's look at the research. In 2000, from 1997 to 2006, they were going to perform a very well-known study known as the Women's Health Initiative. And it made its way into the news, and if you were aware of what was happening in our world at that time, you may remember this. They took 160,000 postmenopausal women aged 50 to 79, and they put them on synthetic estrogens and progesterone, which are very similar to what's in birth control pills, and they wanted to see the effects on the female body. They had to stop the study 4 years early because there was a substantial risk of an increase in breast cancer, in coronary heart disease, stroke, and blood clots in the lungs. This caught a lot of media attention, and they extrapolated out like there had been literally millions of women that were on these hormones in the 60s and 70s and 80s and 90s, and they estimated that hundreds of thousands of women died and developed serious diseases, cancer, cardiovascular disease, as a result of these synthetic hormones. Folks, these are the same hormones that are in birth control pills or implants or injections, whatever form a person may be taking. And so these are what the studies show. Also, as I mentioned, that cycle, that ebb and flow that you lose when you go on synthetic hormones does not happen. And that ebb and flow of estrogen high and then low and then progesterone high controls over 150 other biochemical reactions in the body. and those reactions don't occur efficiently like they should as a result of people that go on these birth control pills. Now, some other dangers that are, this is all in the research of synthetic hormone contraceptives. It depletes B vitamins. Folks, B vitamins are used as cofactors in over 350 enzymes in our body. Vitamin D, vitamin C, magnesium, zinc, all of these are necessary nutrients that are depleted in a lot of our foods to begin with. Number two, it may cause or worsen candida or yeast infections in females. Probably 1 out of 3 female that I see that come into my clinic that are chronically sick have yeast overgrowth, either in the gut, vaginal canal, on their skin. So yeast is a very common problem. So this can cause things like vaginal infections, digestive symptoms, migraines, fibromyalgia, chronic fatigue, psoriasis, and even worsen PMS. So this yeast is something that I have to deal with all the time on our chronically sick patients, but when one is on the pill, it raises it. Number 3, anxiety and depression symptoms and lower libido. What happens is the ratio between progesterone and estrogen gets too small, and it creates an estrogen dominant situation when one decides to go on synthetic hormones. And so they do not ovulate. By the way, when progesterone and estrogen ratio gets too small, that causes anxiety, it can cause poor sleep. Progesterone is very calming to the brain, and it has large impacts on thyroid function, and it's just a really hormone that makes females feel very good. Then they don't ovulate. Obviously, a female does not ovulate when they're on synthetic hormones, and there's a surge of testosterone that occurs at ovulation that females will not get when they don't ovulate due to synthetic contraceptives, and so that lowers libido. Number 4, increased risk of cancer, as we've already talked about. But here's a study. First of all, in the general public, a female has a 1 out of 8 chance of developing breast cancer. Now, there are many reasons for that, and I don't have the time to get into it today, but to me, that is astounding. And one of the reasons is there's so much estrogen in our environment, in our food supply, in our water, and a lot of females are taking it when they're on birth control pills. So that's 1 out of 8. And a woman who takes birth control pill before their first child, that 1 out of 8 goes down to 1 out of 5. So that's a study. And you have to be off the pill for 10 years before the 1 out of 5 goes back to 1 out of 8. Also, high estrogen is very sensitive. Breast tissue and uterine tissue and thyroid are very sensitive to excesses of estrogen. And estrogen's just it's one of the hardest hormones to get rid of out of our body. It lives the longest of all the steroid hormones in our body, and it's in our water supply, in our foods, and all these different things. So it's ubiquitous. Number 5, we know that increased estrogens increase clotting in the vein. We get deep vein thrombosis, which can break off and form what's known as an embolism and travel to the lung and cause pulmonary embolisms. Birth control pills that contain drospirenone are the highest risk for clotting. These are Yaz, Yasmin, Bayez, Ocella, and Zara. The key point is that there are so many things a female can do from a functional medicine perspective to address the female hormone imbalance, the real underlying causes. I go over on my long video the top 6 reasons that I've seen 30 years of practicing functional medicine why females develop imbalances in their hormones and what they can do about it. I would strongly suggest that anyone is on the pill and wants to know how to get off it, to manage their hormones, to watch that video. Functional medicine addresses the underlying why to things, whereas pharmaceutically driven medicine, which is what people get with their OBGYN, is only interested in the symptoms. So taking synthetic hormones is one of those very deceiving medications because often it will get rid of a lot of the symptoms, but it creates all these negative things that we talked about today. And I understand too that it's a choice that a female has a right to make, but they need to be aware of the consequences. I hope that helps. and I hope it's clear. I'm Dr. Ed Beyer. Have a great day.